Hello, SJ here from the Rehab Hub, and I'm here to introduce to you magnetotherapy, now available at the Rehab Hub in Glasgow. If you have any questions, we are live. Please feel free to comment, or if you're watching this in replay, pop us a message. I wanted to just go through what magnetotherapy is. So essentially, it's physical therapy based on the application of a magnetic field with specific features to the human body. And years ago, it was discovered that magnetic field could be obtained by making an electric current through a wire. Basically wrapping a wire around a solenoid, the magnetic fields of each column sum together, which gives a strong magnetic field that is measured in Gauss. So essentially, it is all physics. But essentially, what we have is this magnetic field, and the current is if the current is constant, then the static magnetic field is created, and if the current varies with pulses, then a pulse magnetic field is produced. And basically, what we are doing with this, so you might have seen, relatives or whatever that have maybe got little magnetic bangles and things on, and they're wearing what's called a static magnetic. They're creating a static magnetic field. It's very kind of low energy, but essentially that is what they've got on. What we are doing here is we have got it's a pulse magnetic therapy that we're using. So different substances behave differently when put in a magnetic field, right? And according to their behaviour, they can be classified as diamagnetic, or paramagnetic, or ferromagnetic. And essentially, they can either be attracted or not. So you've as a kid, you'll have played with magnets, and some will attract and some will let's just say pull apart. So depending on what how they are will depend on what they do. Now, basically, biological molecules, our biological structures, cells, tissues, organs, bones, do not alter the magnetic field which passes through the body without losing intensity. And that basically means that the field acts on all the structures, including the deepest structures, so including bone. So when we're using this particular machine, we will be going to bone, and actually some of the best indications of this are for bone problems. So what types of things that this can help with are pain relief, anti-inflammatory, reduction of swelling, acceleration of wound healing, osteogenesis, and bone mass restoration. So things like osteoporosis, these are absolutely where it comes into its own. Additionally, because of the action across the cell membrane, so basically your calcium, there's a calcium influx, right? We have this thing in our body, we have our sodium, potassium pump, and essentially what we have is we have this influx of calcium, and when we get the influx of calcium, what happens is we get muscle relaxation, we get vasodilation, we get protein synthesis, we get mitochondrial activation, and a combination of all these physiological responses lead to an anti-inflammatory, anti-edema, and an analgesic response, and also improve wound healing. That's just what happens. So I'm going to put the machine on to show you it moving. So when a patient comes in, so you've probably seen me coming into a camera here. When a patient comes in, they will lie. So some of you will be down, you'll be watching whatever camera you're looking on. The feet will be down this end and the head will be up here. We will have this for just their legs to be elevated, and their head will be in this position here. I'm just making sure you can see me. If you have any questions as I do this demonstration, just let me know. So I'm going to turn the machine on. You'll hear a few beeps. So bear with me as I'm turning this on, and I'm going to give you a little demonstration of the magnetic field. Now, when you're lying on this, you're not going to feel any pain. You're not really going to feel much. Usually what we'll do is we'll give you a magnet to hold, or just certainly for that demonstration, and let you kind of feel that there actually is something going on. So actually when you're on this, you won't feel anything at all. Right, so let's put this on. We'll do tissue repair. Why not? And we'll do full body, so we can do from the feet all the way right up to the head if we choose to when we're doing this. Here, 50 hertz is going into this, a bit of energy there. And let's go, we'll do full body with this one. I'm going to press start, so you hear more beeping. Position 2. We'll just put this right up. Normally a treatment is anywhere between 20 minutes and 30 minutes when you're coming in and doing this. So you can see this machine, the thing will start to move. Oh, hold on. Well, let's start again, SJ. So happy when you're on live. So I put it to stay at the feet for 10 minutes. That's not going to work, is it? So we can choose through the settings on this as well that if we want to, for example, have it stay in a particular area, we can do that. But for this demonstration, we will have it moving, and we don't want it staying in any one particular place. Okay, so that's it starting now. So you can see this will start to move, and when you're underneath here, you'll not necessarily feel anything. Some people may. So here is now I've got just a magnet, and you can see it's just sitting here. So I'm going to put it in my hand, and I can feel this vibrating just now because this is coming close to me. And as this is going away, it's not doing anything. So what I'm going to demonstrate is what happens to this magnet as I put this underneath here. Now, I personally have got my hip replaced, and you can absolutely use this safely with joint replacements, and actually it is indicated for that sort of issue. Now look at this magnet lifting up. Do you see it? So here is where, and as that goes away, it's reducing that kind of vibration feel that I can feel in my hand. But as this comes over, I feel that increasing. So I'll just take this over, maybe you'll see a bit better from here. So if I place this here, so right now, nothing happening. I can feel it vibrating now. And then watch what happens as this comes over. You can see it's going a bit nuts, okay? And I can feel that vibrating. We'll usually demonstrate that when you're coming in. So when you're lying down there, you'll generally not feel anything. It's a very gentle, nice treatment to have. You're here, it's a very comfortable bed, it's nice and soft. You're not going to be in any discomfort. So I'll leave that on, you can just watch the machine at work. So you rest assured that you're not going to, it's not going to hurt you, it's not going to be sore. Types of conditions that this is good for. So let me just go through the indications of use. There are many, many, many of them, but the most of them are our osteoarticular diseases. So things like fractures. So if you've got fracture that, to be honest, any kind of fractures, hairline fractures, non-joining, non-healing fractures, this is where it really comes into its own. The osteoarticular diseases is really where this is an excellent treatment modality. Femoral head avascular necrosis, so up at the top of your hip. Post-menopausal osteoporosis. So osteoporosis for helping regenerate and build bone density. This is really an effective treatment. Degenerative arthropathy, so any kind of arthritis in the knee, basically arthritis, osteoarthritis, knees, hips, hands, wherever. I've got osteoarthritis in my hip. So I mean, honestly, I have my left hip replaced. I am using this currently. I absolutely can't rave enough about it. One of the big things, especially if you've got joint replacements, is the failure of those joints, and they don't last forever. And it's not that the actual joints don't, or the new joint doesn't last. It's your tissue around that new joint that starts to loosen off, because the bone in your tissue basically doesn't regenerate around that area, and your new joint basically then becomes loose, and that's what your corrective surgery is when you've had a joint replacement. So what I'm working on for myself here is really prolonging and looking after the tissues around my new hip to really get a better result, a longer result. Hopefully, I will live long enough that I probably will need a connective surgery on my hip well into my hopefully 60s and 70s. I hope it's that far away. And this will be certainly, if you have a joint replacement, had surgery, bone, osteoporosis, these types of things, I can't stress enough the use that this can have for you. It's also great for things like inflammatory arthropathies. So your more systemic sorts. So you're thinking rheumatoid arthritis, ankylosing spondylitis, fibromyalgia. The results from fibromyalgia with this in some of the clinical trials have been insane. Those types of conditions, really, really great. Soft tissue and peripheral disease, so any kind of soft tissue disease, so tendinitis, tendinopathy, bursitis, ligament problems, ligament strains, ligament damage, all of these types of conditions, sports injuries or degenerative processes, this is absolutely where this comes into its own. And acute or chronic articular conditions such as back pain, neck pain, tendinitis, painful shoulder. So there's musculoskeletal, osteoarticular diseases. This is really where the therapy machine really comes into its own. So it's magnetotherapy. This is not readily available very much. I think there are a handful of clinics that have this in the United Kingdom. This is not something that is easily available for many of you to get, and you'll all be looking at this. So this looks like a big MRI machine, and is this okay? Yes, it is. There are very few contraindications to this. The biggest, the only absolute contraindication to this is a pacemaker. If you have a pacemaker, we cannot put you in this for obvious reasons. Other than that, things like pregnancy, we wouldn't use it. We wouldn't use it if you had any other electrical devices possibly fitted in you. Maybe you've got Parkinson's, you've maybe got some devices to regulate brain activity, these kind of things, this would not be indicated. But other than that, you are fine to use this. There are very few contraindications to this, and it's very gentle and absolutely divine for remodeling, like really the osteoarticular diseases, right? That's really where this comes into its own. Now, it does have other uses for neurovascular or neuromuscular diseases, so things like muscle sprains, muscle fatigues from overuse, neuropathies, peripheral nerve lesions, and carpal tunnel syndrome. Tissue repair, so pressure ulcers, cutaneous wounds, and psoriasis. So if you've got skin problems, pressure ulcers, issues with ulcers, also indicated. And vascular diseases, so any kind of vascular ulcers, diabetic ulcers, and any post-traumatic edema, so any sort of swelling things there. Those are the types of indications. So just to go over them again, osteoarticular diseases is where it really comes into its own. So things like fractures. Cannot stress enough that osteo just means bone. So essentially anything in terms of your bones. So if you're a woman of a certain age, I hate that phrase and then I've just said it. So if you're a woman who is perimenopausal, menopausal or postmenopause, then you will know how your bones and your joints are feeling, right? You feel that. So I'm there with you. So this is something that hasn't been available that now is. You might have seen it's quite an old-fashioned thing to see where people might have worn almost looked like funky jewellery, might be magnetic things around their wrists, and maybe an older relative, maybe you've seen doing that. I remember, I think one of my aunties had one. Usually people that have maybe get things like rheumatology, you'll see wearing that, and essentially it's the same. Science of this has been around a long time. That's a tiny little fraction of what's going through when you're on this machine. And also, what they're putting on when they're wearing jewellery and things is a static magnetic that's going through. This is a pulse magnetic, totally different. The therapeutic effects are immense. Let's talk a little bit about what a treatment looks like, and some of the advantages of treatment. So one of the case studies that we discussed yesterday when we were training on this course, because this is literally just landed yesterday, was we looked at a gentleman who had been suffering with fibromyalgia. And this particular gentleman wasn't suffering with pain from the fibromyalgia, but actually the biggest symptom for them was depression. And this particular gentleman had a early adult exposure to asbestos and had resulted in damage to their lungs. And actually one of their lungs was kind of folded over in the other. And unfortunately, the medication they were taking for the depression really was causing problems with the issue with the lungs. So we had this kind of catch-22 situation going on. This particular patient, after their course of treatment, was able to come off the antidepressants and subsequently then improve their respiratory response as a result of that. So these are the types of things that that we're seeing in that particular patient that was being treated for fibromyalgia. Everybody's symptoms are slightly different with those kind of things. Now, other advantages are some people will report life-changing treatment, reduction in pain and medication use, deep tissue penetration. There's basically no side effects. It's non-invasive and it's pain-free. It is also really, if you've got a wound, it's because we've got this type of magnetotherapy machine. It's obviously not going to be touching you, so we can keep you, we're not putting anything on you. It's going to be touching the wound, so it's got all the advantages there for that. Another case study that we discussed was a 79-year-old female who was going to physio twice a week, but she was going for arthritic pain. And she was finding that these fortnightly sessions just weren't helping her pain anymore. And then with her magnetotherapy, she found that the pain had massively reduced. So she'd went from a VAS scale of 8 to 9 to a VAS scale most days of 1 to 2, right? So meaning that her pain had gone to when it was excruciatingly sore on a daily basis. Mostly she might get a couple of good days down to just a few wee grumbles, like that 1 and 2, hardly even aware of it or noticing it. It's not fully aware, but it's not affecting her life activities. And she also felt as a result of this, energy levels, sleep improving, pain levels decreased, no longer requiring to go to physiotherapy. In this particular case study, when asked, do you have any further sciatic? So she was also getting sciatic pain because of the degeneration around her spine, and associated structures around the spine were being affected, and that resulted also in the sciatic type pain as well. And she replied basically that her sciatica had completely gone and she was able to move around completely normally. Insane, really, isn't it, when you think of that? Now, what happens with this when somebody's getting a course of treatment, and apologies, I'm not in the camera here, I'm down the end of this bed, you probably see me through here, is that you would come in, so depending on your pathology, you would come in, what you would be doing is you would book an initial consultation. So if you're interested in doing this, what you book in for is basically a normal either physical therapy or podiatry first appointment. It doesn't really matter which one you book in for. If your pathology, your issue is lower limb anywhere from the pelvis down, book a podiatry appointment. If it is in the upper body, book a physical therapy. If it's a combination of areas, which many of our patients are, then honestly doesn't really matter. Just book your initial first appointment, and from there we can just leave us a wee note and we can make sure the right clinician sees you, whether it's a physio or whether it's an MSK podiatrist. It doesn't just let us know what it is you're needing help with, and you might need a combination of both, and we have that there because we have physio here and we also have podiatrists here, so it doesn't really matter what your injury is. And what we tend to do here is not just treat one thing, and this is what a lot of patients will report back to us. They've maybe been seen wherever they've been seen, and they've maybe got lower back problems, they've maybe got foot problems, they've maybe got some knee problems there as well, but they've only had this one episode and nobody's really joining up all the dots of all these areas. And this is really what we do fantastically well at the Rehab Hub in Glasgow. So this is now available. What happens, so I'll give you an example. If, for example, you had, let's just say you've got knee osteoarthritis, then this would be part of what we would call a management plan. if you felt that you wanted to do magnetotherapy, then this would be put into your management plan. You would initially have 10 sessions fairly close together. To be honest, the closer together you can have these sessions, the better. We would normally say you need to have a minimum of those 10 of those sessions twice a week, but you could be coming to see us in daily for consecutive 10 days. But the minimum you would need to free up your diary for is twice per week. And you would do that for 10 sessions. After your 10 sessions, we would obviously assess where you're at. And if you were maybe needing a monthly checkup, say some people like to just do a maintenance plan with us, so they can maybe come on and use it once per month, or it might be 6 months before they need to see us again. It just depends on the condition. So let's give you an example. Osteoporosis. So osteoporosis, we're trying to increase that bone density. We would see you initially for 10 sessions. That would be your big block. We would then not need to see you again for 6 months, and you would do the same. You would do 10 sessions, and you would just continue to do that. So you would need to see us once per year, twice per year. So every 6 months, you would come in and do 10 sessions. That would be for osteoporosis. If it was something like knee arthritis, though, it wouldn't be as intense as that. You would do your 10 sessions, and then from there, you might only see us every other month for one session, just as a top up to keep control. But again, it depends. That depends on your symptoms, your arthritis, and what else is going on. So it just depends. We will be using this alongside, in addition to our already in place management plans. So things, for example, for that we use for arthritis of the knee or arthritis of the big toe. We will use primarily either PRP, so platelet-rich plasma injections, rehab and therapy, manual therapy. Certainly rehab will always be in your program. We might have some manual therapy in your program, and we might also have some injection therapy in your program. Injection therapy can look like it could be PRP, it could be Ostenel injections, which is hyaluronic acid, or it could be a steroid if that was indicated and needed for your particular case. So there's everybody's different. And that might be, you might be getting some injections in there. So for example, I had a lady in this morning where we did an injection into her big toe. She's got osteoarthritis in there. We're doing PRP. She's seeing us for that. And we had her on the magnetotherapy machine after her session after that. So everybody's different in terms of what their management plan looks like. But if we are utilising the magnetotherapy, everybody would have to have 10 sessions with a minimum of 2 per week to get the desired clinical result. How you feel afterwards, technically the research shows that you shouldn't really feel anything for the first 2 weeks in terms of like any effects. There's no side effects from being on this. But the feedback over the last day has been, and I've been on this twice myself now as well, I kind of felt a wee bit buzzing, like I'd been like almost like energized up, like revved up. That's how I would like energy, like I've been charged, if that makes sense. That is how I felt. But I don't know whether that's all in my head. However, one of the other patients who was in this just a moment ago left just saying, I feel a bit as though I'm buzzing, Ashley, as though you've it's similar to what I was feeling, and that kind of like charged up. So certainly maybe that immediate effect of feeling energized. So this is magnetotherapy. It is not available very easily in the United Kingdom. I believe, from my knowledge and from people that I have asked, I only know of 3 clinics in the UK that offer this sort of therapy. So we really are giving you something that is I suppose cutting edge. We're really paving the way yet again here at the Rehab Hub, and it's something that's massively used. Actually, the manufacturers of this are from Italy, and it's massively used in places like Italy and Spain. So you can have a wee look on there. Lots of the videos and things will be in Italian or Spanish, and this is from a company called ASA. So ASA, I'm sure it's ASA Laser or ASA. They're based in Italy anyway. So essentially, this is where it's from. It's this sort of therapy you will see very frequently abroad, but you just don't see here in the UK. So it's been something that we've been looking at to offer to patients that, especially for myself, I have obviously osteoarthritis. It is so debilitating. I do the rehab, I do everything I'm meant to do, but sometimes, and just that change in the weather, anything can just set it off. Obviously, I've had a hip replacement. I am trying to have a healthy, active, healthy life. And if I can use this to help me along the way, then I'm going to do it. So, and I want to have these options for our patients as well. Those patients that are coming in that have got lots of pain all over their body, like our patients with fibromyalgia, where there's really not a lot there that the medical professionals we can do for you. This is something we can start to do. So please reach out if you're interested in finding out a wee bit more. How you would get started with booking, you basically just book a normal clinical appointment. If this was something you wanted to do, this is something that can be included in your plan. And it's not as expensive as maybe you're sitting there thinking. And we do have, because we have just brought this in, we do have some promotions on for the next week. So just ask us about that if you're phoning up or contacting us. There are little incentives there. So it's not as bad as what you would, anywhere near as bad as what you're maybe thinking. So I'm going to sign out there. If you do have any questions, I don't see any questions that have come in, please don't hesitate to ask. But I hope that's been informative. I hope that's helped you see the magnetotherapy in action, and we'll maybe see some of you on the machine soon. And I should say before I head off, we have called this machine Bob. This is Bob. So Bob, we'll see you later.